Hello my dear students, now we'll try to see the last two steps of nursing process, that is implementation and evaluation. So till now what did we see was in nursing process, we were just talking about the steps of nursing process or the phases of nursing process. The first one what we completed was nursing assessment, then we saw nursing diagnosis, planning. Okay, planning we had seen different aspects, prioritizing, setting priority if you remember, yes. Then we had nicely prepared how to write a goal, desired outcome, then our intervention, we have to select the intervention and then we are going to write it down. Okay, so we had seen this in planning. So let us start first with, now the fourth step is the implementation and the last evaluation. Okay, so we'll be seeing about implementation now. So what is the introduction about implementation? Implementation is the fourth, remember this, implementation is the fourth step, okay, of the nursing process, begins after the care plan has been developed. We have nicely planned the care plan, right? That is, if you remember, nursing assessment हमने किया, assessment के basis पे we planned the diagnosis. From the diagnosis we had done planning. In planning what we have done was goal, desired outcome बनाया हमने. We had also listed down the intervention. Now after planning, nicely when you plan ना, plan करने के बाद हम क्या करते हैं? We try to put it into action. So implementation is simple word, is nothing but putting the planned activities into action. Okay, so after your planning is the fourth step, that is implementation. Okay, so after care plan has been done, this is the phase in which the nurse puts the nursing action or nursing plan into action. This is a very important word, that we are literally putting all the plan into action. For example, in the starting of planning, when I said that if you are planning for a vacation, okay, you have nicely planned, you have planned the place, you have decided the hotel, everything. Now when you are going there, okay, when you are going and staying in the hotel and you are going to implement your plan, okay, जो आपने planning किया वो आप करोगे, that is nothing but implementation here also. You have nicely planned the goal, you have nicely planned the intervention, now you are going to implement. आप अपने patient पे वो सारे action करोगे, that is called as implementation. With the care plan based on clear and relevant nursing diagnosis, the nurse then selects and initiates intervention that are most likely to support or improve the client's health status. Now it can happen that you are going to list on many intervention and what is suitable for your patient at that moment, you are going to try to apply it. Okay. What is the definition of implementation? Implementation is a step of nursing process where nurse, very easy, to provide care to patient. वही कर रहे हैं ना, we are trying to provide care to our patient. That is nothing but implementation. The nurse initiates, this is very important, initiate means takes effort. Okay, initiating something, you take an effort to do it and completes the action. She will start it and complete it, whatever intervention has been planned. Completes the action or intervention necessary for achieving the goal and expected outcome. So whatever I have planned goal, whatever expected outcome I have planned, in order to achieve that, I will try to implement the intervention, and it is always related to my goals and means when I am doing it, why I am doing it? Because I have this goal. I want to reduce the fever. I want to bring down the fever in the desired outcome I have written within 1 hour. Are you understanding? So on that basis, I am giving the intervention. The second definition is implementation describes the initiation of the nursing behavior in which the action necessary for achieving the goal and expected outcome of nursing care are initiated and completed. So very nice. Again, the same thing is written, that nurse is bringing out or trying to initiate an action and complete it in order to achieve the goal and the desired outcome. I think the first one is very easy, where it's nicely written that nurse provides care to patient and then she initiates it, completes the action, whatever intervention she has planned. For what? For achieving the goals and desired outcomes. So ultimate we have an aim that we provide care on the basis of intervention plan. For what? For achieving the goal. Okay, for achieving the desired outcome. Now for example, just an example, if you are studying very hard because you had prepared a goal, I want to achieve the goal of getting first, or I want to achieve the goal of getting 70%. So you are taking efforts for it. That is nothing but implementation. Here also, here the nurse is implementing the care to achieve the goal of whatever nursing diagnosis के basis पे जो goal बनाया है, I want to achieve, the nurse wants to achieve. Okay, so on that basis she is trying to provide care to the patient. Okay, next is what are the purpose of implementation, why we are doing implementation. This is the best one, quality care. Remember, from you or from your side, whenever you're giving care to your patient, should be the best quality care. Yes, you should be happy that I've given my best to my patient. I've given the best care to the patient, because once you give best care to your patient, the patient is going to get well soon. Guarantee. Yes, he is going to, because you have taken or you have given your heart and soul to your work. When you're giving best quality care, that is you're doing all. Now this is what you mean by best quality care. You are giving the procedure, or you're performing the procedure as it was taught to you in the college. That is the first step से लेके last step आप सब कुछ कर रहे हो. You're not missing anything. You are, whenever you're giving, you are empathetic to your patient. You're understanding his problem. Is just not giving some medicine. You're understanding him and then giving. You are knowledgeable. You're using your knowledge, applying it, and then giving intervention. For example, if the patient is having hypertension, okay, he is diagnosed as hypertension, and you just not checked his blood pressure and it was coming around, let me take it as 90/60. Now that is hypotension ho gaya hai. Okay, so you know that the BP has fallen down, and now is the time, at the same time there's a time of giving him an antihypertensive. Now उनको आपको और एक BP का medicine देना है, तो will you give it? Should not give it, because already his BP is down. You will make it fall further down. That is using your knowledge. It's just not mechanically working. Mechanically में जैसा बोला है वैसा करना नहीं है. आप you are going to use your knowledge and apply it, because you are knowledgeable, my dear students. You are going to get knowledge. Please, whatever you're studying, see to it that you practically apply. Okay, so here what I'm saying is that try to provide the best quality care. That's why we are implementing the care. Provide continuity of care, because once you implement it, you understand that this is the thing has to be done and this can be changed. Now, for example, I understood that after giving tepid sponge, the fever was not reducing. I had to give him an analgesic. Okay, or I have to give him, an antipyretic to reduce the fever. Okay, so this is what. So I know in order to provide, it helps me to provide a continuous care to the patient, or helps me provide continuity of care. Communicate to the members of the health team. Now, for example, whenever you're caring, you saw the fever is reduced, you need to communicate with the other healthcare team member. Evaluate the feedback of the effectiveness and success of the nursing outcome and order. So what you mean by evaluate the feedback of the effectiveness? That is the end. When you saw that the desired outcome was achievable, then you can just give feedback to the members who were involved with you. Okay, and success of your nursing outcomes and the nursing interventions which you have planned, you can tell them. And if you were not able to achieve it, don't worry, you have to make little changes in your care plan and then provide care to your patient. Okay, these are the purposes. Very rarely as such this question is asked for you, what are the purposes, but you should know why you are doing implementation, right? That's why you're studying this. Next is very important, implementing skills. Skills chahiye na? You require skills to provide care. Okay, so there are three main skills which we are going to study today. That is cognitive skill, interpersonal skill, and psychomotor skill. Let us understand the first one, cognitive skill. That is written to implement the care plan successfully. Nurses need cognitive, interpersonal, and psychomotor skills. That is, psychomotor is technical skills. Okay. Now, first one is cognitive skill. So the cognitive skill, very important, is that we have to apply the nursing knowledge. So whatever you study, at least remember, I'm not expecting that you can remember everything, but at least the basic of the things you should remember. Okay, so apply this nursing knowledge whenever you are caring for your patient. That is what it means. Implementing skill means cognitive skill. You have to use your knowledge and then apply it. Now, once an example I gave you, the patient's blood pressure is been totally has fallen down. Okay, and he is an hypertensive patient, but maybe because of some reason it is fallen down, and that is now the time of giving an antihypertensive medication. Then please don't give it, because already the BP is down. You can't bring it more down. Are you understanding this? Okay, so it includes application of nursing knowledge. It includes problem solving, decision making, critical thinking, and creativity. So that is using your intellectual. आप use कर रहे हो. You are going to use your brain. You are going to use the different skills. The first one is problem solving, because once we are using this cognitive skill is according to different experiences which you get in your life as a student and as a staff nurse. You are going to use that. You are going to get various experiences how to solve a particular problem. So that is, you are using your brain. You have studied in the book that this, for this problem, this has to be done. Okay, so you're again helping in problem solving. Okay, then you are taking many decisions. Okay, once you are giving, now for example, you are giving a patient an IM injection. You have nicely listed down in your intervention that I want to give my patient an IM injection, intramuscular injection. Once you gave an intramuscular, not in the hand, at the region where you are giving, like the buttocks region, or you are giving in the hand, you saw that once I inserted, you aspirated, and in aspiration you saw that there is blood. So you will do what? You will stop that procedure. You will remove that particular needle out, because that is, it's not going in the muscle, it is going in the blood vessel. Okay, so this is what? This is a decision which you are taking according to the knowledge which you are having, right? Okay, and critical thinking. As you know, critical thinking has to be done at the every step of our nursing process. Nicely critically thinking कि ये सही है, is it right, or this has to be changed. And creativity, you can put your creativity to the implementation, or creativity to the work or the action which you are planning for your, or trying to implement for your patient. Okay, that is cognitive. Remember, this is very important application of nursing also. You should have knowledge. Okay. Next skill in implementing is interpersonal, that is with the client, with the family members. How is the relation? So nurse develops, is very important, trusting. The relation between you and your client should be a trusting relationship. Expresses a level of caring, communicates clearly with the client and family. Very important. So when you are caring for your client, this is what I said, empathy. You should have empathy towards your client. You should feel what are the problems of your patient and then care for him. Okay, so then that only the patient will, you are very caring nurse, and I really feel comfortable talking to you about my problems. Are you understanding this? So this helps in developing a trusting relationship between you and your client. Proper use of interpersonal skills enables you to be perspective of patients' verbal and non-verbal communication. What do you mean a patient's verbal and non-verbal communication? For example, if you have a very good relation with your client, that you can understand your patient. If the patient is looking very sad, then you can identify, आज आप बहुत थोड़े sad लग रहे हो, क्या हुआ? So this is what you are nicely able to identify the patient's problem, not only just verbal but non-verbal also. Okay, so this can help. This now how you are going to develop interpersonal skill by having or telling, be honest, try to be honest, tell him whatever is happening, inform him where you are taking him, what medications are going on. Then he feels good that you are nicely communicating with him or telling him what all treatment is going on. Okay, and always be truthful to your patients. Okay, that is interpersonal skills. Next and the last skill which is required is psychomotor. That is the skill of technical skill of performing a procedure. Okay, now you must have seen that many nurses, when they give medicine, some give a medicine, what I want to say is, some give medicine and the patient says, it's paining a lot. And some nurses, when they give medicine, I'm talking about an intramuscular injection, when some nurses, you don't feel like, aapne de diya, pata bhi nahi chala mujhe. That is what? That is a skill where you are not you are giving such skillfully, the patient doesn't understand. And sometimes you give it in such a way that the patient, it's paining me a lot. Okay, so you should be so skillful that the patient doesn't feel much of the pain. I'm not saying that it's not, it won't be painful, it will be, but not to that extent if you're using proper technique. Okay, so it involves integration of cognitive and motor activity. It's very important. It's not only just psychomotor is doing, but you should have knowledge of doing it also. No? When I said that when you inserted the needle for an IM injection, when you saw during aspiration, now aspiration, that's a skill of you're doing it, but you have a knowledge that agar blood aaya, so I'm not going to give it. Okay, so cognition and motor activity goes together. So example is knowing the very nice word which is written, example which is given, First of all, you should know the angle of insertion. As you know, needle has to be inserted 90 degree, right? So you should know the angle of insertion. For example, for an IV cannulation, how much should be the angle? ये सब आपको knowledge से पता चलेगा, right? And the function of the syringe part, a nurse uses good coordination and precision to administer an injection correctly. Precision, the correctness of doing the things. Now, for the first time when you are doing, we can understand you will be supervised by your teachers, but the next time when you are doing, you will be more confident in doing the procedure. But with practice, remember, one time you do it, you are not going to remember it. It's very important that you practice. Practice will make you perfect. Okay, once you practice it many times. Remember, during my time I had practices, we were posted in a government hospital, so we used to get it so much exposure of giving an IM injection that you can tell me now also I can give it nicely, because that is how it has become perfect in me. I don't have to think much because I know the exact steps because of practice. Okay, so this is what is psychomotor. With time and practice, this is what I was saying, the nurse learns to perform skills correctly, smoothly and confidently. First, second time you may hesitate, but once you do it with many time practice ke saath, you will become confident, and so at the end you will be a competent nurse. Competent nurse, a nurse who is efficient not only in the matter of knowledge but also skills. Okay, you have more psychomotor skills also. Okay, hope so you understood implementing skill. We have just started with the fourth step. Okay, the fourth phase of nursing process. We just now saw about various skills which are required while performing or while doing the implementation phase. Okay. Next is the process of implementation. How is the process going on, or how is the implementation process carried out? As we had seen in planning process, the same here we are also seeing implementation process. The first one is reassessing the client. Now here this different points we are going to see in detail. So let us start with the first one, that is reassessing the client. Reassessing the client, very important. What do you mean by this? That during my assessment phase I saw that the patient was having pain. Okay, he was complaining of abdominal pain, and then I formulated a nursing diagnosis. I nicely prepared the goal, the desired outcome and the intervention, and now I am just reassessing and asking him again. Okay, or I am just reassessing his pain. Why? Because you are going to implement something, no? It's better to reassess. Okay, so reassessing or reassessment provides a way to determine whether the proposed मतलब जो आपने plan किया, what all planned action as intervention you have planned is still appropriate for the client's level of wellness. What do you mean by this is, when I said कि at the starting he said me that he is having abdominal pain, and then I came with an analgesic to him. मैं tablet लेके आई अभी. I'm just asking before giving the tablet, how much is your pain? And he's saying that I don't have pain. So you don't have to perform that particular intervention. Are you understanding? This is what. So reassess. Just you are nicely planning your assessment, diagnosis and the goals, desired outcome and intervention. But just before giving, reassess your patient. Okay. So because so that to know that मैंने जो बनाया action है, the intervention which I have planned is right or wrong. Okay. Example, the nurse plans to ambulate. Now this is also very nice example. Ambulate the client following lunch. Ambulate means I am trying to make my client to walk after following lunch, means lunch के बाद. However, a reassessment reveals shortness of breath and increased fatigue. Now, I had planned that I will be making my patient walk after lunch, but once I made him just to stand and he was feeling सांस लेने में तकलीफ, breathing difficulty, and then he was also having fatigue, थकावट जैसा, right? So which requires a nurse to return the client to the bed. I had planned for him, but now I'm not going to do it. I'm going to make him again lie down on the bed. समझ में आया? Yes. So that is reassessing the client. First step in your implementation process. Next is reviewing and revising. Review matlab go through what plan you have prepared, the intervention which you have prepared, and revise. Revise is make the change. Now, the previous example you had seen that I can't ambulate my client. So what you need to do is, if he is having breathing difficulty more, then I can make little changes in my care plan and see to it that I try to solve his breathing difficulty problem. That is mean by reviewing and revising. Okay, the existing जो आपने बनाया हुआ care plan. Now remember, implementation process is not asked in detail any times, but you should know what you need to do in the process. Huh? That's why we are studying in detail. So first thing is what? Reassess the client. If needed, you review and revise your existing nursing care plan. After reassessing the client, the nurse reviews the care plan, compares the assessment data to validate the stated nursing diagnosis and determines whether the nursing intervention remains the most appropriate for the clinical. Is it right or should I make some changes? That is what has been said over here. Okay. Next is, this is written like when you need to modify, make the change in your existing written care plan. The 4 steps which are there: revise the assessment database to reflect the current status. Now when I said that he is having breathing difficulty, so I will be trying to solve the problem of breathing difficulty. Now he was having very severe breathing difficulty, so I will solve that problem. So I am going to change my care plan. Next is nursing diagnosis are revised. Now these are the various factors or steps where you may need to change your care plan. आपने बनाया था कि I want to make him do some activity, but again the problem came, different problem came. So your nursing diagnosis changed. Now it is impaired airway exchange or impaired gas exchange is there. It's not able to breathe. Ineffective breathing pattern is there. Problem. So I will be, when my nursing diagnosis change, I have to modify my care plan. Specific interventions are revised to correspond to new diagnosis and client goal. That is I am changed my intervention. The nurse determine what method of evaluation will be used to determine if outcomes are achieved. Now here again you are going to change this is what? If your problem of the patient has changed, then everything will change. Your assessment will change, diagnosis will change, your goals and outcome will change, your intervention will change. That is what is written over here. Don't worry, nobody is going to ask you in detail about this, but you should know this is all practical based, that how you are going to apply this or how you are going to modify your care plan. Okay. The third step in implementation process, the first one we saw, that we are going to reassess, then we are going to review and modify our care plan. The third one is organizing resources and care delivery. What you mean by this is, अगर आपको care करना है तो you require equipments, you require many things ना, to give care, right? That is what will come over here. Organizing resources, bring the resources. Now if you want to give an injection, you require a syringe, you require needle, you require the medication. So that is what, organizing resources and the care delivery. Okay, so facilities resources include, so in a hospital, that is a facility, or in a home care, or wherever you are working, you require, or what all thing has to be there? Very important, equipment and the skilled personnel. What you mean by this is, you require equipment, and when I said that you require a syringe, but along with that syringe you require a nurse also. That is a skilled personnel, nursing personnel. Okay, so equipment, most nursing procedure from bed making to client teaching requires some equipment. So as a nurse we require many equipments. If you want to do a bed making also, you prepare a tray with many bed sheets, right? If you want to give a mouth care, you require an artery forceps, you require a kidney tray. So all these are many equipment which you require. This is very important that you try to see whether it is in working condition or not. For example, if you want to check your patient's blood pressure, please first check whether it is working. Don't do experiment on your patient. आप patient के ऊपर cuff लगा देते हो and then you try to pump it and then it's not working. Don't do all these things. Please, before taking anything, any equipment, any article you're taking towards your patient or towards your patient, try to see that your equipments are in working condition. Okay. All necessary supplies should be gathered and put in convenient location, usually where they will be used. Now, when you start working as a staff nurse, you will understand that there are various areas where specific articles are kept or equipments are kept. So you keep it there only, so that at the time when you require, you can get it from there. Okay, that it means. So remember, an equipment, very important is that it should be in working condition. Okay. Next is in organizing resources and care delivery. Next is personnel. Personnel is nothing but the person who is giving care. Nursing care delivery system very matlab change among facilities and must be considered when deploying nursing staff. Deploying means when we are recruiting and giving the responsibility to different nursing staff, it should be according to the nursing care delivery system. इसका मतलब क्या है? Hospital में we have a hierarchy, that is we have a nursing superintendent, then we have assistant nursing superintendent, then sister in charges. Sometimes between sister in charges and assistant nursing superintendent we have supervisors also, nursing supervisors. Then we have sister in charge ke niche we have a staff. Now this is a organization structure which is followed. So according to the organization structure, we are going to appoint a particular nurse. Okay, now appointment of the nurse, why this point is written is like according to the experience. A nurse who is too much having experience in an ICU, then we can make her as an in charge, or we can make it ICU in charge. So that is what, when we are selecting, we have to select the best person for giving care to our patient. Okay, the system by which nursing is organized determines the way in which persons are designated for. Now this is what you mean by this is personnel are designated for client care delivery. A care given by a staff nurse is a direct care where she is continuously in contact with the patient. But a sister in charge, every ward, every area has an in charge. Sister in charge is never coming in direct contact, but she is at the administrative level. This is what it means. So every nursing personnel which are there in the facility have a different role, and they have to work according to that. That is what is written over here. Okay, hope so you understood. Next is in organizing resources and care delivery environment. This is very important. As a staff nurse, we have to take a lot of care about this. Client safety has to be our first concern. Client का safety अपना सबसे बड़ा priority होना चाहिए. If the client has sensory deficit, this is a very nice thing which is written. If the person not able to hear, not able to see, then try to make changes in an environment so that he is comfortable. He is having no fear about anything. Okay, he is comfortable under you as you are caring for him. Okay, so special precaution are needed to arrange the environment to prevent injury. A person who cannot see to it that you keep a relative with him, and see to that you keep all the sharp objects away, and you inform him that your cane is nearby, so that he feels comfortable. Okay, if the person is not able to hear, then see to it that you can write it down and give him, or you don't have to shout. Or if he is using a hearing aid, then you tell him to put that hearing aid and then you speak. That is what the environment of a patient we are taking care of. One more thing which is written is using special rooms, providing assistive devices, that is walker or eyeglasses, rearranging the furniture and equipment, making room free of clutters. That is, don't put everything in one area. Whenever you're keeping the medicines, also keep it in the drawer. Keep all the patient's articles or patient's own personal whatever he has brought, keep it inside below the locker. This is how you keep it clear for him so that he can nicely utilize it. Okay, and providing for additional personnel. For sometimes you may require help from other, like we always take help from the from the class 4 workers. If the patient is very hefty and all, so hefty means obese and all, so you can take their help to give care to your patient, that it means. Okay, so environment is a very small part which is covered, but there are many things in the environment. For example, if you're working in ICU, see to it that nobody smokes or comes inside smoking, just because in ICU it's totally there are oxygen lines going on. To the oxygen lines means there are pipelines which are there where patient may be on oxygen. That's why we say that it's a no smoking zone. Next is very important that in ICU patient, those visitors who are coming has to wear an apron. Few good hospitals give apron to the visitors. They also tell them to cover up their shoes, okay, so that we don't cross infect, we don't give infection to the patient. So this whole thing comes under an environment itself. As a nurse, we have to take care of all these things also, so that our patient gets well soon. It's not we don't want him to get any hospital acquired infection. Okay, ideally hospital acquired infections are always called as written gift to our patient. We should never give him written gifts. Okay, hope so you understood about environment. Next is same in the organizing resources and care delivery is the client. So that is now what we were talking about implementation or implementation process mein hame, when we are giving care, we require the nurse, we require the equipment, okay, we require all the articles, but hamara patient to bhi to chahiye na, we require the client. So whenever we are giving care, see to it that the patient is comfortable. Okay, before beginning to perform intervention, the nurse should make the client as physically and psychologically comfortable as possible. For example, your patient is lying on half one-sided and is not comfortable lying down. You're just putting hath de do mujhe injection dena. It's not like that. You have to make him comfortable. He should be physically nicely comfortable lying, and then inform him mujhe aapko ye medicine dena hai. You have to tell him. You just can't pull his hand and then give medicines. This is wrong. Are you understanding? So patient should be comfortable. The place where he is lying down or whatever you are doing, tell him that I'm going to do this, so that he knows what is happening with him. You can't force anyone, or you can't just go and give everything to someone. Okay. One more point which is written, so physical and psychological comfortable. Symptoms such as nausea, ulti jaisa hona, dizziness, okay, or pain frequently interfere with the client's full concentration, cooperation. For example, if you want to give him health education on hypertension, okay, and you know that he is at a risk of getting hypertension, that's why you want to give. And now the patient says, I'm having very severe abdominal pain. No, you listen to me. You can't see him like that. Okay, when the patient is having so severe abdominal pain, you can't start giving health education, because he is not able to concentrate what you're speaking. He can't cooperate with you at that moment. So see to it, let him relax, let his problem resolve. You solve his abdominal pain problem and then you give him health education. Understood? So remember about your client. Remember, it's not just completing up nursing procedures or just not completing up the task which is given to you. It is more important that you understand your patient and then give care. Okay? Have that human touch whenever you are giving care to your patient. Empathy, compassion is required. Okay? So hopefully you understood about client over here in organizing resource and care delivery. Next, the fourth point in implementation process is anticipating and preventing complication. Now anticipating मतलब आपको सोचना है कि क्या क्या हो सकता है. You are thinking what can happen, and this you should do it so that your patient doesn't go in some complication. Risk to client arise from illness. This is very important. Risk तो हर बार होता है. If the patient is suffering from any particular disease or illness or because of some treatment. For example, if the patient is suffering with diabetes, or let me take it hypertension, then and is admitted to the hospital, he is at a risk for going into the complications of, let me take it as maybe kidney failure, or it can be one example, let me take a kidney failure. He is at a risk for going in this complication. The next is that even if he is, even if his BP is normal, so we have to see that he doesn't go, he takes his medicines on time, or you give the medicines on time, and you give him proper health education, that he avoids all fatty food stuff and all. Are you understand? So these are different risks which you should consider whenever you are going to care for your patient. Okay. One more thing is the risk of treatment का मतलब क्या है? For example, ideally, previously whenever we used to give our patient antibiotics, we used to first do a test dose. Okay, test dose का मतलब है sensitivity test we used to do by giving intradermal around 0.1 ml of that particular medicine to check whether he is sensitive to it or he is having any allergy towards that particular medication. So that is what. So if you are doing this, you are nicely protecting your client. And if you're not doing that sensitivity test, you're not checking for the sensitivity of that particular antibiotic, what will happen? If you give that medicine directly to your patient, he may develop, and if he was allergic, he may develop rashes on the body. Are you understanding? Just an example. The nurse must identify this risk, evaluate the relative benefit of the treatment versus the risk, and initiate risk prevention measures. Nothing but what is written is that you should know every treatment has some risk and some benefit. So you should see benefit should be more and risk should be less. So example, risk for developing a pressure ulcer following orthopedic surgery will require traction and bed rest. Now here example is given, a patient who is having some orthopedic surgery, maybe uska limb ka surgery kiya gaya hai, and he is bedridden, he is on traction, okay, and so we know that he is at a risk of developing pressure ulcer. Okay, so that is what is saying. So you have to think about the risk which is, and if in order to prevent this pressure ulcer, what we will be doing? We will be turning him, or we will giving him back care. Okay, so that it doesn't develop pressure ulcer. Hope so you understood anticipating and preventing complication. And the next is implementing nursing intervention. What do you mean by implementing? That's the last step of the process. तो पहले हमने reassess किया, right? Next we review, and if we want, we can modify our care plan or revise our care plan. Next is we have to have resources and care delivery, that we require equipment, we require our nursing personnel, we require our client also, how we are going to care for your client. Okay, then next we had seen about different, how we are going to anticipate, or we are going to think about what can happen, and we are going to prevent complication. This has to be kept in our mind whenever we are caring for your patient. And the last one is implement, karna hai. We have to put the We have to put the planned intervention into action. Action में लाना है, right? So here two main things we are going to study in implementing nursing intervention, that is direct care and indirect care. What do you mean by direct care? Direct care means what all care we are directly giving to your patient. So let us understand first direct care and intervention. Direct care interventions are treatment performed through interaction with the patient. Means directly when you are coming in contact with the patient, what all care you are giving are all called as direct care. So example, medication, you are giving medication, you are counseling, giving physical care, that is the basic cares. Nurse provide wide variety. There are many direct care which a nurse gives. Let us see one by one. The first one is activity of daily living. So this is one of the direct care intervention. Activity of daily living. Our activities usually performed in the course of normal day. They include those activities which we perform normal day. That is, when you get up in the morning, what you do? You must be praying, or you are just brushing up your teeth, and you are then going for a bath, you're going to your washroom. So this is what? These are the basic activities of daily living. So when a patient is not able to perform this basic activities of daily living, then a nurse helps him. Okay. So in the course of normal day, ambulating, eating, bathing, brushing, grooming, condition resulting in the need for assistance with ADS can be acute or chronic. Some patients who are bedridden can't do all such activity or daily living, who have lost their limbs, or some fracture is there, limb, hand. So here a nurse is going to help in this activities of daily living. Okay, hopes you understood this. Next one is instrumental activities of daily living. Now, instrumental activity of daily living is nothing, some instruments here, there are no instruments, but it's little different from activities of daily living, most commonly carried out by nurses who are doing home care services. Most commonly done in foreign countries where nurses are appointed for home care services. Okay. Illness or disability can alter client's ability to be independent in society. So it includes such skills. Now you can see over here, a person who is not able to perform all these cares, that is maybe shopping, preparing meal, writing checks, and taking medications. A nurse within the home care setting. Now I'm not saying the nurse is going to go for shopping or not, but it's like just that she can help in this instrumental activities of daily living. Okay, not commonly performed in the foreign country where the nurse is going and helping at that home level. Okay. So community health setting, excellent opportunity to assist client in adapting to way to perform instrumental activity of daily living. So you should remember first, more than instrumental is activity of daily living, which we as a nurse are caring for our patients. Okay. The next one in direct care intervention is physical care techniques. That is all the care which we give to our patients. Okay. It includes turning and positioning the client, invasive procedures. You are giving IM, sub-Q, intravenous, administering medication, providing comfort measures, all procedures, all nursing procedures will come in this. Physical technique involves a safe and competent administration. This is very important. Please give a safe and competent care to your patient. Okay. Next, in physical technique, we have physical care technique, you understood. Next is counseling and teaching. The difference between counseling and teaching. Counseling means what? Counseling, here you are going to help him in his, or by giving him emotional support, or trying to find out why he is anxious. So you will ask him, kya hua, kyun anxiety hai aapko, kya problem hai. So you are just counseling him. Teaching him, you will teach him on many aspects. Many aspects means what? You are going to teach him about, just I said, hypertension, he doesn't know, or he wants to know how to give an insulin injection. You are going to teach. Teaching is different, counseling is different. Okay, so all these activities also come as a direct care intervention. Remember, direct care intervention means what? Directly you are coming in contact with your patient and caring for him. Okay, there are few more direct care intervention. Controlling for adverse reaction. It is harmful or unintended effect of medication, diagnostic test, or therapeutic intervention. Now, controlling adverse reaction means, just an example I can give you. For example, a patient is having a nasogastric tube. Okay, nasogastric tube is a tube which goes in the stomach, and we try to give him nasogastric tube feeding. The important nursing responsibility before giving nasogastric tube feeding is to see whether the nasogastric tube is nicely lying in the stomach only. It is not gone somewhere else. So we do what? We aspirate. One of the step, we aspirate. And when you aspirate, if you see some fluid coming out, maybe greenish color, so, or maybe food particles, that means it is in the stomach itself. So you can provide your feed. So that is what. And even one more important thing, once you are aspirating, if the aspiration, the fluid which is coming out is more than 30 ml, then you should not give him any nasogastric tube feed. Okay, you can just postpone it for almost 1 hour then and again check it. Why? Because already stomach is full. Or daloge, there can be further chance of maybe aspiration also for him. So it's very important, maybe he may nauseate out or vomit it out. So it's very important you don't give more. Clear enough? So controlling adverse reaction. This is example which I am giving you. Okay, so adverse reaction can be related to any procedure, anything what you are doing on your patient. You should remember कि इसका क्या हो सकता है adverse reaction. You should be remembering this and then performing the procedures. Preventive measure. Prevention includes assessment and promotion of the client's health potential, application of prescribed measure, health teaching and identification of risk factor for illness or trauma. Prevention, you know what you mean by prevention is that preventive measure. Here we are not just caring for our client but preventing him from further diseases or further problems. Okay, so here you need to assess and promote the client's health potential. So कैसे आप assess तो करेंगे, but how can we promote? By giving him health education. We are teaching him that this is the thing, you should not eat this, you should try to do at least or walk for half an hour. This is an example. Okay, application of prescribed measure, health teaching, what I said, and risk factor. What are the risk factor for further illness and trauma which he can have? Which he can have. For that we have to think about and then give him guidance. For example, if I know he is a diabetes, so I know that maybe, and he is having a sedentary lifestyle, so he has to have control of diabetes, that is avoid all this food stuff, okay, and maintain activity so that he doesn't go in complication of diabetes. Are you understanding? So this all comes in direct care intervention. And the next one and the last one here is indirect care intervention. So what do you mean by indirect care? We are not directly coming in contact with the patient but doing for our patient only. Something which we are not coming in direct contact with the patient but doing for our patient only. Remember this. Indirect care intervention or treatment performed away, मतलब आप patient से थोड़ा दूर हो but उनके लिए ही कर रहे हो. Away but on behalf of the patient or group of patients. Okay, many of the measures are, these are many of the managerial work, managerial level ka work hai, such as card checking. What you mean by card checking is once you start working as a staff nurse, you will understand that every nurse has to come. When they come, they have to check for different medicines which are there or different equipments which are there in the ward. We keep a record of it and then we write it down. In the morning shift, this many equipment, this many medicines were there, and then we sign on it. Okay, so that's called as card checking. Okay, next is environmental safety management. When I said that you are taking care that the visitors who are coming to the ICU are wearing apron, are wearing foot cover. So when I'm saying this, you are nicely checking, seeing to that the environment is managed so that we are not giving any infection to our patient. Okay, supply management, that you if you see that some medicines are over, some equipment are not there, you tell your in charge and then that particular equipment and the medication can be brought to the ward or ICU so that we can give proper care to the patient. Telephone, this is commonly done. If physician is not available, we call up and say that the fever is not reducing, sir, what has to be done? I've given this medicine, I've given tepid sponge, then he can order some other medicine. Because that's what telephonic, remember whenever telephonic consultation is done, write it down in your nurse's notes. Nurse's notes mein likhna hai aapko that this has to be done or this has been completed. And transporting the patient. Sometimes you carry your patient from the ward to for MRI and also that also comes as a indirect care intervention. Hope so you understood indirect. Okay, so we completed with our implementation. Next we'll move on to evaluation. Okay, implementation is over. The fourth step we had seen, and we had seen in the process many aspects, right? The last one was implementation of intervention. So there are direct intervention and indirect intervention. So let us start with evaluation, which is the last phase. Now remember, in evaluation, as is the last phase, we'll just revise again. So we have assessment, right? The first step was assessment. The next was nursing diagnosis. Next kya tha? Planning tha, right? Next was implementation. Sorry with my handwriting. And the last one is evaluation, right? That is what we are going to say. Now, how can you remember the 5 steps? Remember, AD, P-I-E, AD pi. Okay, this is a mnemonic for you to remember the 5 steps. But don't write in your exam, don't write in your exam this AD pi. You are not going to get marks. You have to write assessment, you have to write diagnosis, you have to write planning, you have to write implementation, you have to write evaluation. Understood? Yes? So let us see what is evaluation. Evaluation is a final, khatam, end step. You have to evaluate. Okay, evaluate how was the care given, whether it was effective or not. Final step of the nursing process where we judge or appraise. We judge, we try to see whether I have given this all medicine, was it effective? That is what is evaluation. Evaluation is very important. Okay, to see the effect of the care given and was it really effective for our patient. It is planned, ongoing, and this is very important one, purposeful. जानबूझ के करते हैं to know that the care given was effective on our patient or not. Okay, so the client's progress towards achievement of goal and desired outcome, the effectiveness is very important. The nursing care plan which I had planned was really effective or not. Okay, the client's progress towards achievement of goal and desired outcome means evaluation is always planned on the basis of the goal and the desired outcome. मैं देखूंगी desired outcome में मैंने क्या क्या parameters लिखा है, what I have written it down, and then I evaluate this what I have written, but whether I was able to achieve it or not. Okay. So, hope so you understood the introduction. The process of evaluating client's response. So, how can you evaluate the client's response? Identifying the desired outcome. So, that is what I was saying. Once you know that these are the desired outcome, you try to evaluate on that particular basis. Okay. Collecting data related to desired outcome. Collecting data means I have written desired outcome that I want to achieve less, or I want to achieve less pain. Okay, that is within 1 hour. So I will be again checking the pain scale. Okay, I have written 3 on a scale what I want to achieve, and then I will check again after implementing. After implementing, I will check the pain of the patient. It was coming 4 on a scale of 0 to 10. That is what I am going to write it on in evaluation. Okay, compare data with the desired outcome means after, like again say fever. I said after 1 hour the fever should be 100 degree Fahrenheit. So I will again check with the thermometer how much is the fever, and then it's showing me 99 degree Fahrenheit. It's very nice that I achieved my desired outcome. Relate nursing action to the client's goal. Relate nursing action to the client's goal means what? Here I am going to see what is the goal, what is the desired outcome, whether I have achieved it or not. Draw conclusion about problem status. Draw conclusion about problem status means what? Here the problem which I had planned, whether I was able to achieve it. Everything is going around and around, but very important is that it should be related to your desired outcome. Continue, this is very important. Continue or modify or terminate. What do you mean by continue the care plan? Continue means अगर आपको लग रहा है कि इसमें the problem is going to remain, like fever remains for 1-2 days, then I will continue the same care plan. Or if I think that the fever has not reduced, I have to modify some intervention, then I will modify the intervention. Or terminate, fever चला गया, नहीं अभी कुछ नहीं करना है, fever has gone, so I will terminate means totally close up this care plan and plan something new. Okay, new means some new problem is there. Okay, that is what is written. As we had seen implementation process, here evaluation process is also there. Okay, the first one is collecting data. Again, yes, you have to collect data. Now, when I said that I want to achieve less pain, so I have to go and ask him, show him a pain scale. 0 is no scale, 0 is no pain, 10 is severe pain. Tell me now how much pain is you are having. That is what, collecting the data. So, nurse collects data so that conclusion can be drawn, whether the goal was met or not met. Okay, so collection of data, comparing data with outcome. Comparing the data with the outcome is nothing but the desired and the expected outcome. When determining whether a goal has been achieved, the nurse can draw one of the 3. This is very important. That once you are going to compare, ना कि मैंने data तो collect कर लिया, now I am going to compare and see whether I was able to achieve it or not. So in the evaluation format, what you are going to write it down is either goal was met, मैंने जो goal बनाया, I was able to achieve it. That is called as goal was met. That is the client response is the same as the desired outcome. Whatever desired outcome I have listed down, मैंने उसको achieve किया, so we write it down goal was met. If I am not able to meet, for example, if I have written it down that the pain has to be 3 on a scale of 0 to 10, and once I check the pain also, he is telling me after 1 hour 3 on a 0 to 10, then I will write it down in the evaluation, goal was met. Okay, this is the first thing. Or if you see that the goal was partially met. Now, when I checked after 1 hour, another example, I checked after 1 hour and he's saying me 4 on a scale of 0 to 10. I had planned 3 in the desired outcome, but he's saying me 4 on a scale of 0 to 10. इसका मतलब मैं क्या लिखूंगी? The goal was partially met. Partially met. Okay? And the desired outcome is partially met. And goal was not met. मतलब even after checking 1 hour, I'm asking him how much is your pain? He's saying me 8 on a 0 to 10. 8 on a scale of 0 to 10. That means pain अभी भी उतना ही है. That means the goal was not met. Okay, so this is what you're going to write it down in evaluation. The goal was met, goal was met, goal was partially met, थोड़ा achieve किया, goal was not met. Okay, after determining whether a goal has been met, the nurse writes an evaluation statement. This is very important. Once we are implementing, okay, after implementation of different intervention, when we evaluate ना, we have to write it down in this format. Goal was met. कैसे आपको पता चला you have met the goal? Then we write it down the evaluation statement. Let us understand what are the two main parts of the evaluation statement. The two main parts of the evaluation statement is a conclusion and supporting part. The conclusion is a statement that the goal desired outcome was met, partially met or not met. And the supporting, this is very important. Supporting part का मतलब क्या? You are going to write it down. What are the measures which are going to support it? You can see the example here. मैंने लिखा है goal met. How did I say goal was met? That is the oral intake 200 ml more than output, skin turgor good, mucous membrane moist. These are the different things I must have written in the desired outcome. The same thing if I am able to achieve, I will write it down in my evaluation also. Are you understanding? Here, whenever you are writing evaluation, you have to write it down goal met, partially met, not met. So if you are writing partially met, तो उसके आगे supporting data has to be there. That why you are writing like this? Because that this is the problem. The pain is still 8 on a scale of 0 to 10. That's why I have written goal was not met. Clear enough? This is called as a supporting part. Okay. So this is the supporting part and this is the main conclusion what you are making for. Okay. Next in the process is relating nursing activities to outcome. So we have seen just now how we are going to write our evaluation process. First was the collecting data, then how we are going to formulate the evaluation thing. Next is relating nursing activities to outcome. Nurse needs to determine whether the nursing intervention activity had any relation to the outcome. It should never be assumed that the nursing activity, this is very important, assumed that the nursing was a cause or the only factor in partially meeting or not meeting a goal. Remember this, when we are planning this care, it doesn't mean that only and only because of our care the patient's fever has not reduced. You have tried your best, na? You have tried your best by giving him tepid sponge, by giving him antipyretic or analgesic. You have given antipyretic, you have given to the patient to reduce the fever, but still he's having fever. Now this may be because of the disease condition. Like for example, dengue fever, the patient has fever for at least 3-4 days. So it's not something what you are not doing. You are doing your best. Remember this and try to continue that care. And if you want to make some changes, you can do it. Or you can just plan some another care plan for your patient. Okay. So that is relating nursing activities to the outcome. And the next one is drawing conclusion about problem status. When goals have been met, the nurse can draw conclusion that the actual problem is resolved or the potential problem is prevented. When the goals have been partially met or not met, nurse may need to, this is very important, that conclude. You need to conclude whether you want to revise the care plan or you have to resolve it. Matlab, if your goal is met, that means you don't have to continue with that care plan. You can terminate it. Or if you think that the care has to be continued or as I said fever will be there, then you can continue with the care or make some modification in the interventions. Okay. Next is continuing, modifying and terminating the nursing care plan. What you mean by this is continuing. Means as I said, you can continue the care if you want to continue the care because the problem still exists. Modify the care because you find that the intervention was not effective. So I will modify on the basis of the evaluation. And the last one is terminate. Terminate means stop. As I see that the fever has subsided, he is not getting it back. So I am going to abhi nahi hai fever. So I will terminate the care plan and plan new care plan according to the assessment. Hope so you understood this evaluation process. So these are the 5 main things or 5 main process whenever you are writing your evaluation. So very important is the statement, that is goal met, partially met, not met, and then the supporting part you are going to write it down. Okay, hope so you understood evaluation process. Next we'll be seeing an example of nursing process for a better understanding of all this content. Okay, thank you.